Whether you have a diagnosis or not, I don't care. I'll teach you how to find what's causing your health concerns using the labs you already have. Your doctor might tell you your blood work is normal, but I'm here to teach you a better way. If you're a doctor or a health coach and anything in between, there's one for you too. Download your cheat guides and register here at drkylieburton.com. This podcast is sponsored by Systemic Formulas and Nutribiome. Systemic Formulas, the supplement company I trust with my patients and family. Instead of ordering from a handful of companies, I use 95% SF products. They're top-of-the-line quality with the best lab west of the Mississippi. They're pure, potent, and they get results. In fact, I recommend you follow their Instagram at Systemic Formulas Institute. Also, the man who's behind the Systemic Formulas products, Dr. Shane Morris, is launching a new line of supplements designed to take your microbiome to the next level. He has specific prebiotics designed to feed the probiotics. Learn more and order soon at mybiome.com. All right, let's jump into the episode. Welcome to the Beyond the Diagnosis podcast. I am here with a special guest, Peter Lapp. He is straight out of Scotland, and he's going to help us women who are postpartum and teach us how to recover and get our postpartum bodies rocking and rolling so they're healthy. Now, be very careful how I said that. I didn't say back to pre-body before babies, because you look at my stomach and I got wrinkles and they ain't going away. There's like some magic wand treatment out there that gets rid of stretch marks, but I don't think that's happening. So, Peter, welcome on. I'm excited to talk about this subject today because I'm one of them. And there are many more people who are in these shoes. All of us monomas, we always want babies. But we don't realize the dramatic change our bodies go through.
No, it's insane, isn't it? Of all the things that I was really surprised by when I first looked into postnatal exercise and postnatal recovery and rehab and all this sort of stuff, like 10 plus years ago. So it's quite a while ago. The thing I was most surprised about was the lack of preparation women are given during their antenatal classes. The lack of knowledge that is shared with them about what postpartum life will actually look like. So the expectation of, like you said, bouncing back and all that sort of stuff was still there, or at least the aspiration was still there. Said, I need to get my pre-baby body back and all that sort of stuff. And for a long time that was really a thing. And then they come across issues such as diastasis recti, separation of the stomach muscles, pelvic floor problems, pelvic floor weakness, posture issues, back pain, and all that sort of stuff. Pelvic girdle pain, which you can get during your pregnancy. And they're completely unprepared for it. Because no one has really been open and honest about that. These things are completely normal and that they can happen and that they can be fixed.
My first pregnancy, I got pregnant. Literally, I became a mom the same week I graduated medical school. So the last 9 months of medical school, I was pregnant, and it was, in a 4-letter word, hell.
I'm sure, yeah.
Nobody warned me about sickness, about fatigue, and about the mind games that go on. So my first trimester, if any of you are have never been pregnant before, you're about to discover what it's really like. My first trimester, and this is the way I'm understanding it from a lot of women, you get hit by this brick where you just want to sleep all the time. So I would literally roll out of bed 5 minutes before I had to be to clinic. I would get to clinic and my old roommate would do my hair. And I'd throw on a little makeup, or I'd have makeup from 3 days ago still on, and finish out clinic. I'd go home, 6:30 at night. My husband would tell me he wants to go to the gym. Hey, honey, I'm coming with you. I'd fall asleep on the couch. He'd come wake me up. I'd fall back asleep. He would just eventually leave and go to the gym, and I'd sleep all night long. I'd fall asleep in 10-minute breaks up between classes on the couches on campus. Like you literally sleep all the time. And then you get into this. I mean, I'm a small body frame. I'm like
Right.
5'6". My torso is, I always tell people I have an inch between my rib cage and my hips. So as far as me growing a baby, I got nowhere to go but out.
Mm-hmm.
And it was, I mean, I'm big. People, I can't hide when I'm pregnant. I show. Then I got hit with this concept of diastasis recti. I'm in medical school. I've never even heard of that before.
Mm.
And I just bought a spin bike because, you know, I'm going to get back to get my tight abs or blah, blah, blah back. I go to my chiropractor who specializes in postpartum care and
Right.
and even pregnancy care. She says to me, you ain't getting on that spin bike for like 6 months. What? I just bought it. Like, I'm excited to get on it. She's like, no, look at this. So I did the test, and you can help us walk through this test right now to determine if you have diastasis recti, whether you're 2 weeks postpartum or you're 10 years postpartum. When we're talking about diastasis recti, it's this where your abdominal muscles, they get so stretched that they separate.
Mm-hmm.
They just don't go back together and meet in the middle like they should. I probably still have some of it, but I was very grateful for her because I think I had like a 4-inch gap,
Mm-hmm.
a pretty extensive gap. And she was able to walk me through the exact regimen I needed to pull those back together. And when we're talking about diastasis recti and our abdominal muscles, that's where, you know, we're 10 years postpartum and we still look like we're pregnant. No matter
Mm-hmm.
how good you eat, no matter how hard you exercise, that little pooch is still there because our muscles just got wrecked and nobody
Mm-hmm.
taught us how to take care of them afterwards. So talk to us about that diastasis recti, this concept of separation of our abdominal muscles.
Yeah, because it's a fascinating thing. I always say there are two definitions of diastasis recti, which is the simple one is the one that you basically just use. You know, you have a six-pack, you have a line of muscles on one side, you have a line of muscles on the other side, and they're usually about this far apart. And because you get a bit bigger, it moves a bit further apart. That's kind of it. I always make this sign so that in the middle, pretend that that's your belly button, and then it just separates a bit more. That's kind of how it goes. And that can be above your belly button, below your belly button. It can be all the way along that line of that linea alba, which basically runs from your solar plexus in between your ribs all the way down.
I haven't heard that term since school, Peter.
I know this is pretty old school. I get this when I train. I train quite a few medical professionals postpartum, and they're all like, "Oh yeah, I've heard of that, but I forgot about it."
Yeah.
And that is the simple definition is the width of that gap and then the depth of that gap, because that connective tissue between the muscles gets weaker as well. That gets stretched, that connective tissue, and it doesn't, quite often you hear the term it rips, and it doesn't really rip. It just gets stretched to the point that it gets very thin. And that means that you can have quite a deep gap, so you can stick your fingers down that line quite deeply. The way to measure for it is very simple. You just lie on your back and you basically stick a couple of fingers along that line and you measure it. There's tons of YouTube videos that will show you exactly how to measure it accurately. It's a bit difficult to describe it. Then you have a deeper definition of diastasis recti, and this is what I think the important one is that muscle functionality is a big part of it. So you have the width of the gap, the depth of the gap, and then you have muscle functionality. Are your muscles functioning properly? It's exactly what you described, that in a lot of cases, someone's stomach, especially after the first pregnancy, your stomach will go back to some semblance of normality. It kind of goes back a bit flatter and all that sort of stuff. And in some cases, you go back to looking like you did prenatal, as in you might have stretch marks and all that, but the stomach is in roughly the same place. But if you don't do the right exercises, like rehab exercises, then there's still a lot of weakness there, and the muscles aren't quite functioning properly. And that means that if you then fall pregnant with a second or a third or whatever, the diastasis recti will become much, much worse because there is simply nothing holding it back, holding it in place, and the body isn't quite functioning properly. So I always say that the simple definition is indeed there's a gap there, bring that back together. I always say that one of the more important things is that all the muscles in your body, including your pelvic floor, are functioning properly and are doing the things they're supposed to do, so that you can not be in pain, or you can just be comfortable, not have back pain, not have posture problems, and all that sort of fun stuff.
Urination problems too. Nobody talks about those.
Oh no! Everybody lies about them. That is the big thing. I was told that women discuss everything, is what we're always told. And I say, yeah, that's true, except for all the postpartum stuff that they're going through, because you're fine. Because there is this unicorn and rainbows sort of approach to kids, to becoming a mom. Everything is magic, right? And there's rainbows and there's unicorns and everything is superb and everything is, he doesn't sleep well, but I'm okay with that. And there are some people say, I get a bit upset by him not sleeping, I haven't had any sleep for a while, but they never say I pee myself when I laugh.
Yeah.
And they never say I don't go to a comedy show anymore because there's a bit of leakage. And funnily enough, in the UK we have a brand called Tenna Lady. I'm sure you have it in the States as well, something like that, which are basically adult diapers.
You said Tunnel Lady?
Tenna, that's T-E-N-A. And they're like adult, they're pads. Basically, they used to make maxi pads and all that sort of stuff. Menstrual pads, and then they discovered that actually, what's awesome? We can also sell ladies incontinence pads. And the commercials you see for those now, it always used to be an old person thing. You saw the commercial 70-year-old on television and I have accidents every now and again. Those ads are now all 40-plus-year-old women. All of them. As if it's completely normal and acceptable for someone in their 40s who's had a couple of kids to have leakage, to experience leakage. Whereas it is not uncommon, but it's also not right. That is the sort of thing that is fixable. And that's the message that I always like to get out. This stuff is not difficult to sort. And it doesn't matter whether you're 5 years postpartum or 6 weeks or 20 years. This sort of stuff can always be fixed. Because fundamentally, they're muscular problems. And any problem with a muscle can be solved by strengthening that muscle.
Yeah. Let's jump back before we get into more details of this. Sure. And I didn't even know this test existed. So I'm just going to walk people through the Diastasis Recti test, even though you mentioned, there's 1,000 YouTube videos on this. Whether you are 2 months postpartum or 20 months postpartum, stick your fingers just below your belly button, lay down on your back, and then crunch up. If you feel the muscles, if you feel a gap between the muscles, 1, how wide is the gap? And 2, that would be where your abdominal, your muscles have loosened. Now that's really easy because those are surface muscles.
Yeah.
We have a lot of muscles on our pelvic floor. Muscles that are there doing their job, and we have no idea they're doing their job unless they fail at and they're not doing their job. When we don't have the tight abdominals, when we look like we have the 20-week pregnancy pooch, when we have the incontinence, that's when all of these muscles on the inside of our body need help and need strengthened. So Peter, walk us through some simple exercises we can do to just strengthen these pelvic floor muscles.
Sure. So what I always say, the first exercise we start with, and let me just get myself straight for the camera a little bit, so you can see it a bit better. The first thing we start with is what I call the core breath. Learning how to breathe and to contract the muscles properly whilst we're breathing is key. That is the biggest thing you can learn to do postpartum. So what I always say is you place your hand on top of your belly button with your fingers facing down towards your pubic area. And basically just the hand is right on top of your belly button. Then as you exhale, what most people do when they exhale, so take a deep breath in, when they exhale, usually, if you exhale now, people collapse on themselves. People move forward because they exhale from the top down. So the top part of the core contracts first.
Yeah, when we okay, keep going.
But, yeah,
I
so
did
then,
that because I'm like,
yeah, deep breath in and you collapse on it. That is how most people breathe. And that is completely understandable, it's completely normal. But again, it's not quite right. What you're trying to do with that hand on the belly button, deep breath in and then exhale through, and you start to pull from the bottom and up. So in and up, as if that hand moves in and up in that direction.
I have to literally try hard on that.
It is quite a tough move. One of my clients like to call it a really weird analogy. She said it's like picking strawberries with my vagina. That was her cue. And
Okay.
yeah, whatever floats your boat, right? If that works for you, then that works for you. But
I'm sure you get all sorts of
I get loads of weird
analogies.
stuff. Yes, the one I prefer is, imagine having a piece of string and that just pulls everything below your belly button up as you exhale. So in and up as you exhale. And that means that the bit below your belly button is contracting much harder than it otherwise is.
Okay, wait. Am I getting this right? I'm supposed to move. It goes up as I exhale.
As you exhale, always as you exhale. So what I'll do, I'll stand up for a little bit. And if I don't step on my dog. And I'll move my chair out of the way. So what I always say is here and moves from here. So you pull in and up the way. That is the move you're making. So big breath in.
Okay, I'm trying to do it on the inhale part. So
I'm sorry, I've just put my headphones back in, so that's nice, steady. And again, nice deep breath.
That's not a normal way to breathe.
It is not. It's a very unusual way to breathe for most people. And yet, once you get good at this is the only way you'll want to breathe going forward. And I've never come across anyone who gets good at this type of breathing, because obviously we're exaggerating the movement here. So what we're doing here is really focusing on that contraction. But if you can do that core breath during normal exercise, squats, lunges, even kettlebell workouts and all that sort of stuff, if you can teach your body that you want to engage the muscles from the bottom up, you will find that you'll become much more effective at exercise.
To get good at it, what do you recommend?
Just 3 sets of 10, sometimes throughout the day. That's all you need to do. In the beginning, it's a very gentle exercise. In the beginning, the focus
But it's not
is
like it's not. I'm sitting here trying to do it, and it's not something I would just do on my own. Like I have to really focus on it.
But we have to, when you do any sort of postpartum exercise, any sort of rehab exercise, because essentially postpartum exercise is rehab exercise. It's getting the body to function properly again.
Which we don't think about it. Like you don't think,
no,
I'm postpartum, now I need to go to rehab. Your body just went through trauma.
Mm-hmm, exactly.
You and the baby.
Yeah. It's
treat it like that, and then it's just like a car accident. I mean, if you get whiplash, you're going to go take care of your neck. If you go through labor and delivery, you should probably take care of your pelvic floor.
Exactly, it is exactly
normal.
that. Yes, no, it is exactly that. This is why I always think it's such a shame that these things don't get taught that way. It's always a little bit seen as. In most cases, when women give birth, and you'll probably relate to this to some extent, during antenatal classes, the focus is all on the baby. How are you going to breastfeed your baby? How are you going to best take care of the baby and all that sort of stuff. There's a little bit, you get a little bit of attention, and during most antenatal classes, at least in the UK, there's a little section on whether your partner feels neglected when you're pregnant and when there's a baby there. which is very kind of them. There's more focus on the partner usually than there is on the woman. Once you've given birth, the woman basically becomes completely inconsequential in any sort of healthcare issue. As in, and this sounds very dramatic because it kind of is, because the focus is all about the baby. So in the UK, you get a 6-week checkup with your GP. And the 6-week checkup postpartum is mainly to make sure baby's okay, and you get a couple of questions with regards to your own mental well-being. Postnatal depression, that's kind of what they look out for. If you're lucky, it's a bit of a postcode lottery, but if you're lucky, you might get that Diastasis Recti check from your doctor. But a GP doesn't really specialize in this sort of stuff. Right? That is not what their job is. That's not what their role is, so you don't expect them to either. But at no stage do you, as standard, get referred to a women's health physio.
We usually go back to our gynecologist or our OB.
Right.
I have a midwife, so I go back to her for my 6-week checkup. But even then, she didn't test me for that. I tested myself because I'm aware of it and I know.
Yeah.
But she didn't test me for it or even mention it at all.
No, it tends not to be. It tends to be seen as in the UK, and I know with regards to surgery in the US, it tends to be seen as an aesthetic issue rather than an actual medical condition. And all this pelvic floor problems, diastasis recti, all that sort of stuff, it is a genuine medical condition. This is not something that only happens to a few people. I mean, 100% of women that are pregnant are affected by diastasis recti at some stage. Because you have to be, because you're creating room for the baby to grow. So that means there has to be more space created. Now, that doesn't mean at the 6 weeks postpartum stage, 80% of women still have that simple definition of diastasis recti. That gap is wider. That's 80%. 30% of women have it for more than a year postpartum. And that is just looking at the gap and not even including things like muscle functionality, whether stuff is working properly or not. Things like pelvic floor issues are not classed as an issue because fundamentally they are just not deemed serious enough. Whether you can go to a comedy show without wetting yourself is not really seen as a major problem. And the issue is, of course, that once you've given birth and you're at that 6 week stage and you have a shiny new baby to take care of, and it's overwhelming, whether that's child 1, 2 or 3, there's a lot happening at that stage. If we then charge women a significant amount of money to see any sort of pelvic floor specialist or personal trainer or something like that, it becomes yet another barrier that we put up, that most people can't afford to throw $1,000 just at a couple of personal training sessions in the hope that something sticks. Right? It's an expensive business sometimes to fix this. So I always say that this sort of stuff should be available through your insurance company, or in the UK it should be available on the NHS. Unfortunately, nobody agrees with me on that one.
Well, here's the other thing too that I've learned is people will find what they will value and pay for what they value.
Sure.
And when it comes to, there's a whole entire brand that has gone after this. That brand, like everything else that I like to point out on this, is managing your symptoms. You are finding a way to manage the incontinence. Are you really beating it? No. If you want to beat it, think about how many pads you will say that you're going to pay for in the next 35 years because you never went back and did the work to strengthen the muscles. They're muscles. They strengthen, they relax, they become weak. The power is in our hands. And it's just a matter of us taking control over it and searching for somebody in our area with it, with that expertise. Because I'm not going to go to any PT. There's PTs who specialize in athletics and sports injuries, and there's PTs who specialize in car accidents. And you got to find a PT who specializes in the pelvic floor, and so they'll know what to do and how to help you through. But this isn't something that we just have to suffer with. And as women, I'm going to even start doing these breathing exercises myself. And if you're listening, figure out how well or not well your stomach is, your abdominal cavity. And then for a third tip, Peter, for the listeners, what would you recommend as a third tip?
So the third tip is keep it simple in the beginning. In the beginning, we're all learning about how to switch things on and how it should feel. And then you have exercise. Quite often, what we tend to do is we overcomplicate recovery. Recovery from a muscular injury, which is essentially what we're talking about, is always very, very straightforward. This is why physio sessions with a physiotherapist, are always so remarkably boring. They are never exciting. This is never gym stuff where you do like 1,000 kettlebell swings or the CrossFit workout of the day. It's always simple exercises that get the muscle functioning properly. So all you need to get is, say, a couple of resistance bands or something like that. The long resistance bands are about $6. They're cheapest chips, and you can hook them around any sort of door frame, and all you need to do is a wood chopper exercise. For instance, you stand and you see my hand moving from here and you move it to there, and that's less tension over here, and there's more tension on the band over there. So just pretend I connected the band to a point over here, and if you do that, your core will engage. And if you combine that with the breathing that we're talking about, then that will help fix your diastasis recti in 100% of cases. Like I said, there are several forms of diastasis recti, so being aware of which one you have, above your belly button, below your belly button, or completely open, as we call it, that matters for the exercise program you're following. So if you can afford to go see a personal trainer or a women's health physio, because like you said, you have to see a specialist in this field. Yes, I basically, for the past 10 years, have done nothing other than postpartum personal training. Nothing else. I mean, I have 1 or 2 athletes that come to me for core training, to improve their balance, because they see that there's a clear definition between a clear link between athletic performance and core stability and all that sort of stuff, core functionality.
Yeah.
But fundamentally, you have to deal with the postpartum side.
Let's say this: women, make yourself a priority. Say yes to yourself. Find somebody in your area, and then you can go enjoy those things that you love to enjoy, and you're just not doing anymore because you're scared to have the accident or whatever.
Exactly, and it's exactly like what you were talking about. The long-term expense of not doing something is significantly higher than the short-term expense of doing something. Mm-hmm. The amount of people I've spoken to that have had diastasis recti and the mummy tummy, I hate the term, but the rounder tummy for
That's
10
right,
plus years.
That's right. I probably have it right now.
And they'll have it for 10, 15 years. Saying that is just the price I pay for having had a child. But that means you're buying new clothes. That means you're buying stuff to cover that up. In 9 out of 10 cases, like you said, if you have pelvic floor weakness, you could well be spending a lot of money on pads and all that sort of stuff. And none of that stuff is actually necessary. You can save yourself a fortune on buying clothes that cover up the bits you want to hide. Yeah. Just by doing some simple exercises and going back to your old clothes.
Right. So if you're wondering where to learn more, go join Peter on Facebook and Instagram. Facebook at Healthy Postnatal Body, Instagram at Healthy _post_natal_ body. His website is healthypostnatalbody.com. I'm sure you're giving plenty of tips and tricks and things on where they can just get started and start working on their own.
And the nice thing, the premise behind Healthy Postnatal Body was that, in America it costs just focusing on America. In America it costs $4,500 to have a child, even if you have insurance. That is your medical bill on average, $4,500, even with a decent insurance company. So I said, okay, it then should not be expensive to heal the postnatal issues that come from that. So I give everybody 3 months completely free access. Doesn't matter who refers you, you just log on, you sign up, you get 13 weeks completely free access. That is enough for most women to heal their diastasis recti to a large extent. That's free exercise programs, that is free advice. You can email in, you can listen to the podcast and all that sort of stuff, which you can do anyways, it's free. But you can email in and I answer all your questions personally, and or at least one of my assistants, one of my lovely assistants does that. You can cancel on day one and you still get 3 months completely free access. So there is no commitment there. If you decide to hang around, it's only $10 a month for as long as you like it. So it doesn't have to be expensive, but like you said, you have to work with an expert. You cannot just leave this stuff up to random people or to somebody who says, I've gone through this, I think I have a solution. What you come across a lot in your profession, people just going, well, XYZ worked for me.
I was
maybe
sick one time and I fixed myself, so I can fix everybody else now.
Yeah, exactly. I stopped eating potatoes and that solved the problem for me, so you should also stop eating potatoes. That's the example. I was just, that's not how it works.
Where can they get access to that?
healthypostnatalbody.com. And
Okay.
it's
Everybody
exactly
go there.
like what it is. Yeah, we do exactly what it says on the tin, right? It is healthy postnatal body. That's all we're trying to do.
Cool. I like it. I'm gonna go check it out myself. All right, Peter, this has been great. I know so many people are like, yeah, that's me. That's totally me. I need to do something about it. I just need to make it a priority. Make it a priority. Do it for yourself in 2022. Make it a priority. And you too can have a healthy postnatal body.
Exactly. Lovely.
Whether you have a diagnosis or not, I don't care. I'll teach you how to find what's causing your health concerns using the labs you already have. Your doctor might tell you your blood work is normal, but I'm here to teach you a better way. If you're a doctor or a health coach and anything in between, there's one for you too. Download your cheat guides and register here at drkylieburton.com. This podcast is sponsored by Systemic Formulas and Nutribiome. Systemic Formulas, the supplement company I trust with my patients and family. Instead of ordering from a handful of companies, I use 95% SF products. They're top-of-the-line quality with the best lab west of the Mississippi. They're pure, potent, and they get results. In fact, I recommend you follow their Instagram at Systemic Formulas Institute. Also, the man who's behind the Systemic Formulas products, Dr. Shane Morris, is launching a new line of supplements designed to take your microbiome to the next level. He has specific prebiotics designed to feed the probiotics. Learn more and order soon at mybiome.com. mybyome.com.